All right, all right. Let is let's get this going. Get my camera angles together and bring this over here. All right, bear with me. Let me get folks on Facebook up and live. Hey y'all. Howdy, 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 howdy. How you do? I love Heavy D. It's that kind of day. We needed this. All right, let's do the Just Chamia Show live community check in. Let's do this. All right, we are going live on Facebook now. I am going to pause this music that I don't own. That was Nothing But Love, Heavy D and the Boys. Because sometimes it bees like that, and you need to listen to some good music, which I need in my life and I love. All right. Hi. Hey fam, how y'all doing? Happy Sunday. Today is Sunday, January 24th, 2021. I'm so proud that I just did that without looking at the calendar. You always see me looking at the calendar to remember what day it is. Can't promise that I won't do that at some point during the show. But anyway, we're here. Happy Sunday. We made it. Another week, another day. And I'm glad to be breathing and alive and healthy. And I'm glad to see y'all. So, welcome to the live community check-in where we are here to talk about what y'all want to talk about. So what you want to talk about? What's important to us Black folk? I have my topics, lots of good stuff to cover today. I have so much. In fact, I don't think that we can cover it all. We probably won't cover it all. So many links to share and things like that. DM me at Chamia LeRae here on Facebook or at Just Chamia here on Facebook, Instagram, Twitter. And I want to hear like what's on your mind. I appreciate those of you who have been sharing articles and videos and just different stuff with me, putting out that knowledge into the universe. Thank you. Feel free to email me, info at chamialarae.com if you want to just stay in the loop and informed on what we have going on, including the COVID doc that we're doing. So we just want to know, Black folks, how y'all living during COVID, what you think, where you're at different points as we go through this pandemic. Having conversations with folks who work on the front lines in hospitals has been, it's been amazing to do, but it's been crazy, like the stuff that I've been hearing. And their experiences. So, shouting y'all out right now, healthcare workers, whether you are EMTs, paramedics, nurses, custodians, intake or discharge coordinators, doctors, whatever, y'all in there. And we appreciate you. In addition to all of the grocery workers, the Instacart folk, the Door Dashers, the Postmaters, the Caviar folk, the Uber Eats people, all y'all. Thank you for allowing me to stay safely in my home. All right. So we're going to get started because, like I said, I have a lot to go over today. So I am going to start by sharing some interesting things that I've seen from around the gram. Yeah, let's start with it. Let's start with what we've seen from around the gram. So I'm going to share my screen. All right. There's been so much. One thing I want to share, this is from So Oakland. So they shouted out at Youth Spirit Artwork, who were building tiny homes for young adults 18 to 25 who are homeless. And I think that's super dope, and painting them up, making them look nice, feel like a home. So shout out to y'all for doing great work. Thought that was super dope. This is some shenanigans. When somebody sent me this, I was like, is this for real? No, this has to be a lie. So no, this is real. This is what your billions given to the Black Lives Matter political organization will yield you. Twerk on Washington series. Okay, let's stop that. Yeah, so that was a lot. We saw here locally in the San Francisco Bay Area, there was reports about a man with a gun approaching folks marching on MLK Day, telling them to leave, get out his city. Y'all don't belong here. Y'all going on home, y'all. This is right here in the San Francisco Bay Area. Of course, stuff like this happens everywhere, but let us remember, okay? Racism isn't just in these few places. I love the NAP ministry. If y'all don't follow them, one of the sisters in this Black Women's Support Network put me up on them. So thank you. Shout out. I believe it was Carla. Thank you. Who put me onto the NAP ministry. And sister here just be spitting game. And I am so about that NAP life. But she posted this, which says, "You are exhausted physically and spiritually because the pace created by the system is for machines. Woo. And not a magical and divine human being," which we are, but damn, you are enough. Rest, child, rest. Oh my God, this spoke to my spirit so deeply when I saw this. Thank you, Nat Ministry. What a word. Love that. Sis Teslin, come on, y'all, check her out on the gram on everywhere she's at, and she's a political commentator. So she's been posting a lot of just real talk before, since, every day. But anyway, this post, she says, Senator Kamala Harris is the first woman VP. Notice I didn't mention race because I'm going to let y'all argue about if she's Black or not, because people are still doing that foolishness without me, even though I know you will reply with your opinion anyway, but she is indeed a woman. I'm too sure someone will object to that because they just come with the shenanigans and we just can't be here for that. Brother Van Lathan, not to be confused with Van Jones, says in response to Pete Buttigieg, this is the day after the inauguration of Joe Biden and Kamala Harris, and Pete tweeted whatever, special sunrise this morning. How does it look where you are? Because the world is different, and unicorns and rainbows and gold pots for everyone since the inauguration. So he's like, how does it look where you are? And so Van says, the same. This ain't no fairy tale. Get to work. Facts. I appreciate you, brother, for that. And just two more real quick. There was some good stuff on the gram, some good nuggets. So this is from Miss Kenny, who always keeps it real as well. Love her stuff. She says, a real one's gonna tell you when you aren't living up to your potential. They don't let you sit around being mediocre, thinking you're lit. Wow, isn't that great? Because we all need real ones in our lives to tell us and remind us that, you still got work to do. Yes, your shit is funky, doesn't smell like roses. That's good, but you can do better, so on and so forth. I appreciate that. It's not always easy to hear in the moment, but thank you for telling me what I need versus what I want to hear. Love those reminders. And then I just thought this was so precious. This sister here, this little baby, listen to her, y'all. I loved it. Oh my God, that's just my mood when I'm dealing with the shenanigans on a regular basis. When people come at me with the BS, when people talk about all we needed was Biden and now the world, pick a thing. That little sis right there, oh my gosh, so on point. And she was singing, she was in the hand was going in it, the eyes was closing, everything. I loved it. So anyway, those are just a few things from around the gram that brought me some joy or inspiration or food for thought or that's what they do, whatever it is. Just some things from around the gram that I saw that I wanted to share with you today. COVID numbers. I want to get into that in just a second here so we can see where we are at with COVID. So the last time we were together, let me tell you where we were at. Last time we were together, we were at 22,293,281 cases of COVID in the US. So this was on the 10th, so 2 weeks ago today. And then globally, 90,045,410. So that was 2 weeks ago on the 10th. As of today, Sunday, January 24th, 2021, we are at 99,056,336 cases globally. So that's a jump of 9 million in 2 weeks globally. And then in the United States, as of today, we're at 25,098,380 cases of COVID here in the United States as of today. Wow. So there's a lot to talk about regarding COVID. And the numbers that I'm sharing as a reminder are reflections of those who have gone and gotten tested for COVID. So there's a lot of people who may have it that are unaccounted for because they may be asymptomatic or thinking it's fever or thinking it's allergies or thinking it's something else and not going and getting tested. We also know that globally, access to testing, there's huge disparities in various countries, not just to testing, but also to these vaccines. That's a whole nother mess. But we need to be aware of the numbers. I want to pause real quick and say, hey to y'all on Facebook Live. Hey, how y'all doing? Good to see you. Thank you for coming up. I appreciate you. We have so much that we're going to get in today. Thank you, cousin Randy. Hey, girl. Happy New Year. Love you. Mama Gail, you missed last week. I don't know. On the 10th, we gave a shout out to Brandon. Please pass the word because we are very proud of him for achieving and obtaining his doctorate from Yale in engineering. Go young Black greatness. Salute to you. All right. Lots of stuff to get in. I'm going to be throwing lots of links at y'all. The first link, as a reminder for those of you who are on Facebook who want to comment and come in and give me your sauce, you could do it in the comment section, but you can also click that Zoom link that is there in the description if you want to come on camera and say what you have to say. Come on down. All right, but lots of information I want to get into with y'all today. So you ready? If not, oh well, let's get into it. Okay, so I'm going to start with some updates and information about COVID. Of course, there's the Black population as well. And I want to talk about that because, a theme overall, whenever we're talking, hello, you know what we do. We talk about, okay, so what does this mean for Black folks? And so with COVID and these vaccines, it's so much. And everything we talk about, there's the impact to Black folks. So we are going to come back and talk about that. But I want to start by talking about these variants, y'all, because these variants are something else. So the first link that I'm going to put in here for Facebook is to an article from Deadline talking about this Denmark variant. And so you've been watching the show, you know that I've talked about this a while ago. We talked about the Denmark variant being found in Israel. And in Denmark, they killed all the minks population off because that's where they thought it was coming from. Yada, yada. Okay, Chamia, what does this mean today? Well, guess what? I'm about to tell you. So with this Denmark variant, there's questions around if it's resistant to the Pfizer and Moderna vaccines. There's questions around how prevalent it is because we don't know how prevalent it is in the United States or in California, because the fact is in the United States, we just aren't sequencing samples. When people go and they get their tests, we're not sequencing those enough to see what the variants are. And then also there's some of our tests who can't detect the variants. Again, we talked about that. I shared links. And it's a fact that this Denmark variant is likely possible for the Kaiser outbreak in Santa Clara. But let me share my screen with you. And let's read what's shared in this Deadline article and why it's relevant. So this is from Deadline.com. And the title of this piece is "Another New COVID-19 Variant Discovered in LA Might Be Vaccine Resistant, Researchers Say, Strain First Identified in Denmark." Okay, so I give you the links. You go read the whole article yourself, but I've read it and I'm going to highlight some things that were interesting to me. You let me know what you thought. So I'm going to read just the highlighted text. I'm starting here. Known as L452R, the newly announced arrival was first identified in Denmark in March last year, 2020. It showed up in California as early as May 2020. Dr. Charles Chu, a virologist and professor of laboratory medicine at UCSF, who, in concert with other state authorities, has been genetically sequencing tests to identify new variants, and said early indications are that this Denmark variant might be less susceptible to the currently approved vaccines, but more investigation is needed. And that's what I've been telling y'all all day about these vaccines. More investigation is needed. Those first two are still under investigation, where their conditional use authorization is granted based on the ongoing clinical trials for that Pfizer and Moderna vaccine. Let's continue. This variant carries 3 mutations, including L45 or L452R, and the spike protein, which the virus uses to attach and to enter the cells, and is the target of 2 vaccines that are currently available in the United States. So the 2 are the Moderna and the Pfizer, said Dr. Chu. A spike protein mutation could then interfere with the vaccine's efficacy. So they don't know if these vaccines are effective against this variant, or really against many of the new, more emerging variants. But let's continue. The variant was identified in several large outbreaks in our county, said Santa Clara County Health Officer Dr. Sarah Cody. She called that correlation a red flag and must be investigated further. The new variant also has been detected in Los Angeles, Mono, Monterey, Orange, Riverside, San Francisco, San Bernardino, San Diego, San Luis Obispo, Humboldt, and Lake counties. It's all over the state. Because genomic sequencing is sparse, it is currently unknown how prevalent L452 is statewide, nationally, or globally. Dr. Chu said L452R grew from about 3.8% of the samples he tested in late November 2020 through early December to more than 25%. So it was at roughly 4% of the samples. Now it's more than a quarter in just a month's time. Other things, there's also the potentially more contagious UK variant, B117, on the horizon. LA County public health officials confirmed the first case of that strain in the area over the weekend. Problematic because it's been here for months. But anyway, that's a whole nother. Saturday may mark the strain's first identified appearance in Los Angeles County, health officials said in recent weeks that it was very likely already circulating in LA. B117 had previously made its way through San Diego, San Bernardino counties, blah, 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 is found in Colorado. The CDC warned that the presence of B117 may mark a new phase of exponential growth in total COVID-19 cases. All right. We can now add to that the threat of a potentially vaccine-resistant strain, L452R, as well. All right. That's just one. And there's a lot more. I want to know what you guys are thinking about this as we're sharing. There's a lot of information to get through. That is just one piece that I want to talk about, because we need to be tracking what's going on with these variants and the vaccines. Some additional information. I'm going to post this article. So it's an NPR article. You post it in the comments for those of you on Facebook. And the reason why I'm posting it in the comments is because I want you to have the information. I want you to have the information so you can read it and know it for yourself. Remember, we talked about stopping with the bullshit, looking with our own eyes, listening with our own ears, and thinking for ourselves. So I want you to be able to do that. I also want you to be able to share information with those who need it most. And we need this, y'all. So I'm going to go to this NPR article next, if I could find it, because I have a million tabs open right now. I'm like, Lord, do I have to open another one? Where did I hide this piece? Lord, where is NPR? All right, let me just do it this way. Because I don't want to do it like that, though, because I know here it is. I'm like, where is my tab? Oh, this is one from NPR. Here it is. Okay. So let me share my screen with y'all. It's just so much we need to know, and I had a couple of NPR articles because we are going to get into a whole bunch. But let's start with this piece, which the title of this NPR piece is dated the 21st. So today is the 24th, just a couple of days ago. And the title of this piece is Reinfections More Likely with New Coronavirus Variants, Evidence Suggests. So again, I read this, I highlighted things that I wanted to share with y'all. It's too much to go in an hour and a half, and I have so much to get to today, but I'm sharing the links so that you can go back and read it for yourself. Here's the publication, here's the title, there's the links on Facebook. It's still going to be on my Facebook for those of you who find this later through our YouTube channel, which please do subscribe to Chamia Ray Productions YouTube channel. Those of you who might find out from Instagram, Twitter, whatever, come back and read this stuff. So let me read this to you because this is some crazy stuff. And there's studies from around the world. We got to watch what's happening with COVID around the world to get a picture of what's possible here and what is likely to happen with us Black folks. So this particular piece starts at looking at what happened in Brazil as an example of what could happen in other places, including with reinfection. So back in April 2020, COVID-19 hit the city of Manaus, Brazil, extremely hard. In fact, the outbreak there was arguably the worst in the world. One study published in the journal Science estimated that so many people were infected that the city could have reached herd immunity, that the outbreak there slowed down because up to 76% of the population had protection against the virus. So 76% of the people, the majority of the population there had got it. Now the city is seeing another massive surge in cases. This time around, the outbreak appears even larger than the first one, says Marcus Lacerda, an infectious disease doctor at this hospital down there. The surge is so large that the hospitals have run out of oxygen, and patients on ventilators who need extra oxygen to breathe have literally suffocated in hospital beds. I'm really afraid I'm seeing lots of people dying, people that should have had better support in the hospitals, Lacerda says. This is important. Why? If it happened there, it could happen here. What have we heard over the last several weeks? In Southern California, 6th largest global economy in the world, okay? They're running out of oxygen. They had told their medical workers, if you don't think they're gonna make it, don't bring them to the hospital. This stuff could happen here, y'all. So we have to pay attention. I'm gonna continue because all of it, I mean, I could stop and talk on any sentence for just days and go on, but let's keep going. All right, in many ways, this resurgence in Manaus doesn't seem to make sense because such a large proportion of the population was infected just last spring. So in theory, these earlier patients should now be immune to the coronavirus. So why is the city seeing such a large surge? Well, last week, scientists in Brazil detected a new genetic variant of the coronavirus that has been circulating in Manaus since at least December, and it is likely fueling the second surge. And so they're talking about that. There's growing evidence of new genetic variants of the coronavirus, specifically the ones circulating in South Africa. So we've talked about the South African strain around Brazil that may be capable of evading the body's immune system. And thus, mutations in these new variants can make it easier for some people to get COVID-19 a second time, says a virologist at the University of Cambridge. And we know that you can get reinfected even with the same version of the virus. So it's not even just the mutations you can get again, it's the regular COVID that you can get again. We need to know that. No one knows yet how common these types of reinfections will be, Gupta says. They could be rare, but reinfections could increase as time goes on and a person's immunity to the virus naturally wanes, he adds. Manaus is just a lighthouse that is pointing to what could happen in the rest of the country, he says, and perhaps to what could happen in the rest of the world. So this is very important. This is an example because they're talking about herd immunity all here. You hear about that a lot here in American media. You hear about we need to get vaccines, get everybody immune, which I want to say this right now, very early on in the show, while y'all are watching, let's listen. And I want you to hear this very clearly. I want you to go and read the information for yourself so you can know what the vaccines do versus what they don't, because so many people, medical professionals, are confused. And they are not giving you the right information because they don't even understand it themselves. You need to go and read what the vaccines are versus what they are not. The vaccines, Pfizer and Moderna, that are being given do not stop you from getting COVID. Pause. I'm not frozen. I'm pausing because I want you to hear that. The vaccines don't stop you from getting COVID. What they do, and they're designed to do, is stop you from developing the most severe side effects of the virus that will cause you to be hospitalized and intubated. So putting on a ventilator. That's what the vaccines are for, to prevent you from getting so sick with COVID that you have to go on a ventilator. It doesn't stop you from getting COVID. It doesn't stop you from spreading COVID. That is not what these vaccines do. That is not, okay? So y'all need to know that, oh, I got my shot, I'm good. No, you're not. You can still get COVID. You can still get very sick, right? It's just less likely that you'll be so sick that you have to be on a ventilator, but you can still be sick. Why? Because COVID is doing all kind of crazy stuff in the body, y'all. Crazy stuff, causing brain bleeds, blah, blah, blah. I don't have to get into it all today because I have stuff that I specifically want to get into, but you really, really need to know for yourselves. That's the first piece of misinformation is around what these vaccines are. The vaccines are not to give you immunity to COVID. They don't do that. You can have the vaccine and get COVID, okay? And they don't work right away. They have to build up in your system. But even when they build up in your system, you get both shots. They don't stop you from getting COVID. They don't stop you from spreading COVID. They stop you from developing the symptoms that are most severe that can lead to you being on a ventilator, okay? Can y'all please stop saying I'm immune and getting on a plane and showing up at parties and doing crazy shit because you think you could get this vaccine and it's gonna fix things. That's not true. All right, let's keep going because again, there's so much information today. I'm gonna be sharing another article. Y'all, it's a lot of reading, but it's worth it. So I wanna talk about another variant, which is the South African variant, which is at least 50% more contagious, and they're saying has not yet been identified in the United States. I'm sharing the article. And Miguel, I see your question. If you already had it, then what? Well, then you could get it again. That's it. Then monitor yourself and your life over the next year or two and see how you're feeling because there are reports coming out. Go and watch the last episode. I believe I shared some links to that. There's also lots of emerging information coming out about long haulers. So people who have had COVID, recovered from it, and then months later, they start getting sick with all kind of random crazy stuff. You just have to be mindful. Doesn't mean that you're immune. Doesn't mean that you can't get it again. That's what the and what is. And then what? Okay. So here's another article around the South African variant. And I'm going to share my screen again for those of you on YouTube or watching this later, and even those of you on Facebook Live right now. Because again, I read it all. I want you to read it for yourself later, but let me give you some highlights from this piece. So this is from Business Insider. And the title of this piece, which came out on the 19th, so this past week, the coronavirus variant in South Africa is 50% more contagious than the original strain, the country's leading infectious disease expert says. All right. So they're saying that comparatively, so this coronavirus variant appears to be about 50% more contagious, maybe a little bit more. The Western Cape region took 107 days to reach 100,000 cases in the first wave of infections compared to 54 days, just 54 days with this new variant. And they know just through testing that it's spread to 14 countries worldwide, but has not yet been identified in the United States. Why? Why again? Because our tests, and I shared with you guys on the last episode, go back and watch it from the 10th, the letter that the FDA sent out to healthcare providers and clinical laboratory staff about some tests giving false negatives or not being able to detect some of the variants. And there's other research that shows that of all of the testing being done in the United States today, and so today meaning as of this week, what I was reading, so within the last 7 days, the data is showing that less than 1%, so they estimated about 0.3% of COVID tests are being sequenced for variants. Problematic. So these variants are likely already here. We don't have travel restrictions from these places, but that's okay. Let me give you some more from this piece. It's not okay, but I'm telling you, I just want to keep moving. The coronavirus variant spreading in South Africa is 50% more contagious than the original strain, but not more severe, the country's top infectious disease expert said Monday. Asterisk that for future thought, okay? Because that's also what they said about the UK variant, but we're going to get to that in a minute. So they're doing this, and how they get this information is from mathematical modeling that predicted what the infection rate would have been without the new variant. So this is how they're getting to that, okay? I'm going to scroll down a little bit. We are now seeing today more cases and more deaths than we ever on any day saw during the first wave. This rapid rise in cases is also accompanied by hospital admissions. Most unfortunately, we also see deaths rising, Kareem said. There's no evidence to suggest the variant is more deadly, Kareem said, but a faster spreading variant leads to more infections and therefore more deaths. Come on, y'all. Come on. And this is what we need to be aware of as Black people, because why? We know that in this country, in the United States, COVID is killing Black people and Native Americans. I'm just going to talk about Black people more than any other ethnicity of people. And it's more than just the COVID that's killing us. There's some other things we're going to get to, but it's more deadly. So if these variants are spreading more infectious, then they're likely to kill us faster as well. This is why we need to know, Black folks. All right, so most new cases are caused by the new variant there. And their latest data, 59 out of 61 of the sequences that they done. So 59 out of 61 came up with the new variant. It is now the predominant virus spreading in our midst. We need to know this stuff. The places where these new variants are showing up, they're taking over. They're taking over. They're spreading faster. They're much more contagious. All of that. We need to know that, because if it happens there, it can be happening here. But it gets worse. So I shared with you guys the link to that FDA test. I'll share it with you again here for those of you on Facebook. You guys can Google. It's on the FDA's website. The letter that they sent out about testing, giving our tests here in the United States giving false negatives, and what you should do, which is not rely just on the test. You got to look at how the person is doing overall. But again, with the majority of cases likely being asymptomatic or being caused by asymptomatic spread, you can't just bank on people being sick. So, I mean, it's so deeper than rap. These are things that we've been talking about over time, and we need to know. We need to know and be aware, share information with each other as well. I'm going, there's an article from Nature magazine too that I want to share with you. I'm going to paste it into the chat for those of you on Facebook, and then I am going to share my screen for everyone. Again, I've done a lot of reading and research. I want to give you guys the information that we need so all of us can be healthy and we can give the information, make the best decisions, an informed decision on how you want to live, how you want to move, what you know about the virus, how you get treatment, if you do vaccines, all of that. We need to be armed up, tooled up, gamed up on COVID, y'all. All right, so I just shared with you a link to this Nature magazine article. I am going to share my screen. Okay, so from Nature magazine, this piece says, and this is dated from the 21st, so again, just a couple days ago. There's been just a tsunami of information these last few days, and we all need to be here for it. It's a lot of work to stay informed. It is a lot of work to stay informed, if y'all heard that, but you have a responsibility to do it if you're trying to live, and I'm trying to live and be well. So this one is called, or the headline here is Fast Spreading COVID Variant Can Elude Immune Responses. Evidence that a variant of the coronavirus identified in South Africa might compromise immunity sparks concerns about vaccine effectiveness. So I just told you about that. Evidence is growing that some coronavirus variants could evade immune responses triggered by vaccines and previous infections. So if you had it before and then you get a new version, you're getting it because you don't have immunity and the vaccines are not effective. Researchers are trying to make sense of a tsunami of lab studies released this week that raised concerns about some emerging variants and mutations. Quote, some of the data I've seen in the last 48 hours have really scared me, says Daniel Altman, an immunologist at Imperial College London, who worries that some of the results could portend a reduction in the effectiveness of COVID-19 vaccines. Skipping down, there is now proof of several reinfections with the South Africa variant, says De Oliveira. It seems increasingly likely that the variant's ability to spread in places hit harder by earlier waves of COVID-19 is being driven in part by its capacity to evade immune responses that developed in response to earlier versions of the virus. I'm saying a lot, and I hope you get it. And Marlona, I see that you're on. I can hear you. Do you have anything that you want to comment on or to say? Welcome. Can you hear me? All right. I don't know if you're on mute, but I can hear you. I mean, I can't hear you, but I see that you're on. And if you get yourself off mute and you want to chime in, uh, please do, because we want to hear from you. All right. One more thing here on the variants, y'all. You need to know, and oh my gosh, this is like, wow, because we talked about this UK variant some weeks ago. I shared like this variant that had popped up in Australia, New Zealand, and I was like, we need to watch this. Next thing we know, they're saying it's this variant in the UK that was acting the very same way, 70% more contagious, but they weren't saying that it was more dangerous or leading to more deaths. That's what they said just a few weeks ago. I've shared the links on the show. Go back and watch prior versions. But then this week, are y'all ready for this? All right, let me share my screen once again. Information we need to know, and we have to stay on top of what's happening everywhere. Again, because if it's happening over there, it can happen here. Borders are open, people travel and move all over the place, not just people coming here, but us going too, y'all. And this is an invisible enemy, and it's killing us. And it's killing us more than these other folk here in this country. So I want us to know. So what came out this week? You see here on the screen, this is from The Guardian. UK COVID, new coronavirus variant could be 30% more lethal than original as it happened. So Boris Johnson, the prime minister, said that there is some evidence that the new virus variant is linked to higher degrees of mortality. So it could be 30% more deadly. There's all kind of stuff in this summary. They were going through and saying all kind of stuff, and there's been updates. And then they did this press conference, and then the media was able to ask some questions. So, and they had, their infectious disease people up there answering, and, the top health officers asking as well. So they asked the question, can those who have been vaccinated mix together? And Whitty says, even with a very effective vaccine, there is a period of time straight after where there is no effect for 2 to 3 weeks. That protection won't even be complete with 2 vaccines, he says. At that moment, a very large proportion of people you come into contact with could have the virus, he says, on average 1 in 55 in the UK or 1 in 35 in London. There is residual risk even if you've had the vaccine, he says. Again, why? Because the vaccine does not protect you from getting COVID. Black people, do you hear me? These vaccines that are still very experimental, in my opinion, it's my opinion that they're still experimental, but the fact, the scientific fact, and it's reported everywhere, but you can also go to Pfizer.com or to Moderna's website and see for yourselves, read for yourselves that these vaccines do not stop or protect you from getting COVID. Again, they protect you from developing the most severe symptoms that will lead you to being hospitalized and intubated. That's what the vaccines do. So Valence says, we still don't know how effective the vaccines are at stopping you from catching the virus or passing on the virus. It's very important not to assume you can't catch it or pass it on after vaccination, he says. Y'all better hurry up and listen and notice stuff for yourselves. So this UK variant is not only 70% more contagious, it's 30% more deadly. It's 30% more deadly. And we need to know this. One more piece that I'm going to share here in the chat for y'all on this UK variant. This is coming from the Washington Post, because I'm sharing news from a variety of sources. Why? Because that's responsible. And if any of you are getting your news and information from one source, even 1 or 2 sources, if it's just local, if it's, just CNN, MSNBC, I'm not saying that all the information you get in those places is wrong and incorrect or unfactual, but what I am saying is that you need to build a habit of getting information from multiple sources, from validating the information that you're being given. And when it comes to COVID, you can't wait on your local news or any one channel or outlet in this country to tell you everything when it's acting so crazily and evolving so fast and so quickly. Both the virus, the variants, the vaccine effectiveness, the long-term information, all this happening so fast all over the planet. So you need to be getting news and information from all over the planet to understand what it means for you and what could happen where you're at. So that's what we're doing. So I just put into the chat this Washington Post piece And I'm going to share this with you on my screen. Again, I read it all. I'm just going to share some highlights. But I encourage you to go and read it for yourself. Look with your own eyes, listen with your own ears, and think for yourself about the information that's available. And then to share the information that we need with our community so we can make informed and wise decisions. So this piece is from the 22nd, so just 2 days ago from the Washington Post. And the headline here: Denmark is sequencing all coronavirus samples and has an alarming view of the UK variant. So Denmark, the labs over there are doing something that we are not doing here in the United States, which is sequencing all coronavirus samples coming in. So what does this say? Because, oh my God, I read this and I was like, oh, popcorn, like put the Real Housewives down in 11 hip hop and pick up some of these articles, because it is just as entertaining, more scary, more, oh my gosh, all of that. Okay, let me read it. Like a speeding car whose brake lines have been cut. Like I told y'all, they got the drama in here. Like a speeding car whose brake lines have been cut. The coronavirus variant, first spotted in Britain, is spreading at an alarming rate and isn't responding to established ways of slowing the pandemic, according to Danish scientists who have one of the world's best views into the new, more contagious strain. Cases involving the variant are increasing 70% a week in Denmark, despite a strict lockdown, according to Denmark State Serum Institute, a government agency that tracks disease and advises health policy. Quote, we're losing some of the tools that we have to control the epidemic, end quote, says Tyra Grove Krause, scientific director of the Institute, which this past week began sequencing every positive coronavirus test. That part. To check for mutations. By contrast, this is in the Washington Post, based right here in America. By contrast to Denmark, who's testing every positive coronavirus test for variants, the United States is sequencing 0.3% of cases. That's less than 1%, ranking it 43rd in the world and leaving it largely blind to the variant spread. Oh my God, did she start talking louder and yelling? Yes, I did, because oh my God, y'all hear this shit? It's out here, y'all. It's out here. We ain't even testing for it. Here it go. Did y'all know Chamia been saying, oh yeah, here it go now. They telling y'all publicly it's available. Then they go on to talk about Boris Johnson. British Prime Minister Boris Johnson on Friday suggested for the first time that the variant may be more deadly than the original virus. 30% more is what they're saying now, potentially even more than that. Because it can spread more easily, it can also quickly overwhelm medical systems, turning previously survivable bouts with the virus into perilous ones if hospitals are full and medical care is limited. Why is this important, y'all? Because where y'all at? I know down in Southern California, their ICU capacity has been 0 for over a month. Here in Northern California, we're all on purpose status and locked down. Why? Because our ICU capacity was so low. It's happening there. It could happen here. They're telling y'all we need to pay attention. We're not even tracking it, and we need to. And with this virus, this UK variant, 70% more contagious, 30% more deadly, is more easily spreadable, can quickly overwhelm. We need to be aware. Danish public health officials say that if it weren't for their extensive monitoring, they would be feeling a false sense of confidence right now. Oh my God, that's how I feel. I feel like we have a false sense of confidence in America. But the British variant is spreading so quickly that Danish authorities project it will be the dominant strain of the virus in their country as early as mid-February. Well, look, y'all. I mean, today is the 24th, so they saying like in days. That will put Denmark ahead of the United States, where the CDC, Centers for Disease Control and Prevention, warned Friday that the UK variant known as B117, the UK variant we've been talking about, could be prevalent here in these United States by March. Sooner, y'all. They talk about March. Y'all don't worry, we got time. Guess what? We just saw earlier up in the article. Keep scroll back up. I'll scroll for you. The United States is sequencing 0.3% of cases. We're not even testing to see if where the variant is, how prevalent it is. So they don't know. by March, if y'all testing for it, by next week, potentially. Danish officials say that as a result, daily coronavirus cases there could quadruple by the beginning of April. Charts from the Public Health Institute's project that the worst case contagion scenarios, even with a strict lockdown in effect, cases will skyrocket. Quote, this period is going to be a bit like a tsunami in the way you stand on the beach and then you can see all the water retracts, as cases drop, Krause said. Afterward, you will have the tsunami coming in and overwhelming you. What do y'all think about this? What do you think? I'm just setting the information out there. I hope that you read it. For me, this is what I think. Thank you to my mother-in-law for my beautiful glass. I think that COVID is real. I think that there is obviously so much that our medical and scientific community still don't know about this virus, and that it's moving and acting in a way that is unlike anything they've ever seen. That is changing and evolving so fast and mimicking so many different things that they're just trying to stop the worst of the symptoms as best as they can with the information that they know right now. What does that mean for us? What do we need to do? It means that for us Black people, that if you thought COVID was bad in 2020, there are variants that are now in our population that are even more contagious and more deadly to us. At least the Denmark variant, the South African variant, and the UK variant. I'm not even talking about the Japanese variant or anything else, potentially that's out there, because there are others. There's dozens of variants, but at least those three we know are significantly more contagious. We know that the UK variant is more deadly. I think that the South African and the Denmark variant also have the potential for being more deadly, but we just don't have enough data to prove it yet. But we as Black people can't wait for all the data to prove what we know. And here's what we do know today, so we should be acting on: that COVID in this country is more deadly to us than others. And so we should be limiting our social interactions with anyone outside of our household. So those of y'all keep seeing on Instagram and this place and that place taking advantage of the very, very low airfare flights and all that, I get it. I understand, fam, but sit your ass down. Now is not the time, because you fly somewhere where they're not wearing masks and it looks cool and the numbers are lower. No, maybe they don't have the infrastructure and the reporting and the testing that we do. Did you consider that? Did you consider that you going over there and not wearing your mask, that you spread in COVID, whichever one of these 18 million variants we got here in the United States, to them? It's irresponsible. Stay home, sit down. Arm yourself up with information. Why? Because we know that we don't have all the information here. We're not even testing for these variants. We saw that we're testing less than 1% of the millions and millions of COVID tests that we're administering. We're testing 0.3 of 1% of those for these variants. We know that our very own FDA, because I've shared the link, have told clinicians, I'm talking about healthcare providers and clinical laboratory professionals, that the tests are giving false negative results, and many of them cannot detect the variants. So you need to know this. And then you need to sit down. And if you have to go out, because people do have to do some stuff. Some of us have elder relatives we need to check on, or got to go to the store, or whatever you're doing, and you got to go to work, So what do? Mask up. Keep your distance. Wash your hands. When you come in, change your clothes out of all of that. And don't do stuff that's unnecessary. There's things you want to do where you feel, I just need, don't do that right now. Because what you need to do is keep living. Yes, Gigi Gale, you will need your PPE in 2022, if not longer. What a fact. stock up. And that's a whole nother area of digging and data that I need to get into around this PPE, because there's emerging information and guidance around, should people double mask? I don't know if you've been seeing in some professions, people are wearing 2 masks. They'll wear a cloth mask and then a surgical mask over it, and then a shield and all that. But there's emerging data around whether or not you should wear a double mask. There's also emerging data around the dangers of cloth mask versus the paper mask and all of that. So that's a whole nother thing I got to research. Once I find some credible information and guidance and direction, I will share that with y'all. But the point is right now to wear the mask. We also know that masking does not prohibit you from getting COVID. It reduces your risk of exposure. It reduces the risk of you breathing in, because if we're wearing our mask properly, again, if we're wearing our mask over our nose and our mouth, how we're supposed to, and y'all can still hear me, right? You can still hear me. I can still hear you. Wear your mask over your nose and your mouth. But we do know that masks reduce your risk of exposure, but it doesn't stop you from breathing something in or from spreading something out. Masks don't do that. It reduces your risk. So you need to wear that. But yes, Gigi Girl, we will be wearing PPE for a long while. All right, what else, Chamia? Because I've been on COVID and it's been almost an hour, but there is so much. And I'm not gonna read this article out loud, but I'm gonna just post it in the chat here. So I thought it's interesting. It's another piece from The Guardian, but there's lots of different news sources around the world that picked up, which is Israel's Dr. Fauci. I forget the Mister's name, but Israel's version of Dr. Fauci said that the single dose of the COVID vaccine, and he was specifically talking about the Pfizer, is less effective than they thought. Pfizer said that if you get the first shot, between the first and the second shot, that is 50% effective in prohibiting you from developing those most severe symptoms that will lead to you going to the hospital, being intubated, yada, yada. But this Israel's version of Dr. Fauci said, nah, bruh, it's not even that much effective. That single dose is not even that. It's not even 30%. So nah. And why that's important for us to know, and I thought that is interesting and something for us to monitor, is because y'all's president is talking about that we need to get as many shots into people's arms as possible. So he's talking about 100 million shots in his first 100 days. Don't worry about the second dose. Just if you have the supply, put it in people's arms. I understand the reason for that. And I guess they're thinking something is better than nothing, but you guys need to know and watch the data and what they're saying about that. And then if you don't have the second dose within this certain time period, is it effective overall? Do you have to start up? There's so much, because why? None of that shit was studied. None of that was done in clinical trials. So again, before you go get some shit put in your body that's still experimental, read about it. See what they doing. Because it's all very, let's figure it out as we go along, right? Which then I'm going to segue that into the conversation that has shifted in the direction of Black people. So in terms of Black folk and COVID, we know that the conversation has shifted to Black folks don't trust the vaccine, they ain't getting it. They putting all these there's a campaign to get y'all to trust this vaccine. Trust these people, believe what they say. Kareem Abdul-Jabbar told y'all to go get the vaccine. They're bringing out the Black celebrities, and there's only 3% of all doctors are Black doctors. I mean, so few of us are the doctors and nurses anyway, but they bringing out them couple. Hey, don't we have one? Like bring that brother down. What is he? He's he's a foot doctor. Don't matter. Come down, bring him down and tell him to tell his people to get the vaccine. Let's bring the preachers in, the Black church. Oh, they listen to them, even though the numbers and the influence of the Black church has significantly declined in the last 20 and 30 years. But let's dust off these Black preachers, give them a couple dollars and have them come tell their community to get this COVID vaccine. All right, so they are campaigning to y'all to buy the product, to do what they need y'all to do. We're not unfamiliar with the tactics. But the problem that we have is how they're talking about us. So I'm gonna share something with you, and I read this and I said Kaiser should be shamed. Let me post this in the chat for y'all real quick. I'm just gonna post two things. One is from the Kaiser Health Network, whatever their Kaiser's nonprofit wing, and then the other is this Time article. Both are talking about distrust and why Black folks don't trust the medical community and how it's becoming problematic when it comes to the vaccine distribution efforts. So I'm just going to share a couple points and then I'm going to talk about it because I know I've said a lot and shared a lot real fast, but I want you to go back and read the information for yourselves. Okay, please do that so you can know. So this is khn.org coming out of Kaiser. They've done their own studies. So Black Americans are getting vaccinated at lower rates than white Americans. Duh, we know that. So only about 3% of Americans have received at least one dose, blah, 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 blah. Okay. Black, Hispanic, and Native Americans are dying from COVID at nearly 3 times the rate of whites, according to the CDC. And non-Hispanic, Black, and Asian healthcare workers are more likely to contract COVID and to die from it than white workers. That's problematic. Again, I'm doing this documentary. Black folks, I just want to hear from you. It's just like this. Me and y'all talking on Zoom about your experience in COVID, what you know, all of that. Hit me up, DM me, email me, info@ChamiaRay if you're willing to have a conversation. I can't tell you how many healthcare workers I'm talking about. Our folks is working in hospitals and stuff like that, that's getting sick or hearing through the grapevine because they're not being told when there's positive cases, in their workplace. Literally, the person you sit next to could be COVID positive or tested COVID positive, and you won't be told. And people are dying and they're not being told. But anyway, so Kaiser says that. They go on, as the public health commissioner of Columbus, Ohio, and a Black physician, Dr. Myshika Roberts has a test for any new doctor she sees for care. She makes a point of not telling them she's a physician. Then she sees if she's talked down to or treated with dignity. That's the level of mistrust, she says, public health officials must overcome to vaccinate Black Americans. One that's rooted in generations of mistreatment and the legacy of the infamous Tuskegee experiments and Henrietta Lacks. A high-profile Black religious group, the Nation of Islam, for example, is urging its members via its website not to get vaccinated because of what Minister Louis Farrakhan calls, quote, the treacherous history of experimentation, end quote. The group, classified as a hate group by the Southern Poverty Law Center, is well known for spreading conspiracy theories. Okay, let me pause altogether right there because this is such a damn problem. And Kaiser, shame on y'all for putting this shit in print and putting it out for the world to see with your so-called credible ass information. Shame on you. Shame on you. Shame on you for this is a reflection of what's, because we all through this I've been talking about what it means for Black folks. And we talk about racism in America and the examples of it. This is an example of it. Now, for a while, they were looking at it, the Black Lives Matter organization, which is definitely problematic entity for me, but at classifying them as a terrorist organization. And the Nation of Islam as a terrorist, or are you kidding me? Y'all won't even call them terrorists who stormed y'all Capitol building terrorists. They're still rioters. So the fact that, come on, clown shit. This is some clown shit, but y'all need to know it because they talking about us. They talking about us and who we believe and what we listening to. I'm gonna come on over to Time Magazine real quick. And I've already shared these links in the comments for those of y'all on Facebook. So Time Magazine, and this is end of December, fueled by a history of mistreatment, Black Americans distrust new COVID-19 vaccines. Y'all can read it, but I'm just gonna go to a couple little paragraphs in here. It don't even take much, whatever. But meanwhile, there's a real concern that the distrust public health officials face with Black Americans could impact the country's ability to reach their goal. So according to a late August, early September poll by the Kaiser Family Foundation and the Undefeated, some 70% of Black Americans believe that people are treated unfairly based on race or ethnicity when they seek medical care. It's more than that of us that think that, but all right. It's a feeling I want y'all to pay very close attention to the language that they use when they talk about us. I can't even read this sometimes. I'll just being mad and fussing at the TV or fussing at the screen. But let me read the words, their words. It's a feeling born of unequal access to care and intensified by the pandemic, which is disproportionately ravaging Black lives, both physically and economically. The circumstance of the pandemic necessitated a quicker than usual development process, which has fostered misperceptions for many Black Americans that corners are being cut, because they talk about it was called Operation Warp Speed, and just the name was problematic for Black people. Ooh, Warp Speed, that's too fast. Okay, let me skip down. The poll released by the Kaiser Family Foundation December 15th revealed that among racial and ethnic groups, Black Americans are the most hesitant to get the vaccine and continue to remain skeptical. In the survey, only 35% of Black adults said they would definitely or probably get vaccinated. All right, these surveys come as the nation's top health leaders urge Black people to trust the vaccine, hosting live events with Black health professionals at the forefront. Again, they're gonna put all the people that y'all trust up there and say, come on, Kareem Abdul-Jabbar, y'all know Kareem with it. He done converted to be a Muslim and did all this. And, you know, we know Kareem. In the focus group conducted in early October by Kaiser and the Undefeated, Black participants cited systemic racism for their vaccine hesitancy, noting the infamous government-backed Tuskegee syphilis study that started at Tuskegee in 1932. And they're saying the study did not end until it was exposed to the press in 1972. How many years is that? 40 years that they was experimenting? And has gone down as one of the nation's most egregious examples of medical racism. But medical racism does not end there. Researchers have documented many ways that Black patients are treated differently from white patients in the US. For example, in its 2018 annual report, the Agency for Healthcare Research and Quality, part of the US Department of Health and Human Services, found that 40% of the measures of healthcare quality the agency assessed were worse for Black people than whites. And any of their numbers, because history has taught us this, any of their numbers regarding us and mistreatment or adverse effects in anything, whether it's response to a natural disaster, treatment in healthcare system, beatings by police, whatever, we know that the numbers are unreported. So they found 40%. We know that it's more than that. Since the era of American slavery, Black people have faced mistreatment from many medical institutions, like the Tuskegee syphilis study. Henrietta Lacks, who died in 1951 of cervical cancer, reflects the profiteering of Black bodies in the name of advancement of science. I mean, I could go on, but I guess part of the takeaway here, y'all, what they're saying is that we don't trust their healthcare system and their vaccines because of Tuskegee and Henrietta Lacks, and 40% of us have experienced some stuff, mistreatment in the system. For those of you who are Black, who grew up with Black relatives, like maybe your mom was Black, your grandma was Black, your daddy was Black, maybe you had some Black friends, Black neighbors, Black cousins. How many of them have experienced racism in their lives? I'd venture to say it's somewhere near to 95 to 100%. And when we think about the inequalities that we face, nevertheless, all the experimentation, including this live COVID vaccine experimentation, but it's not just in the past. It's not just that it ended in 1972 with Tuskegee. It's not just that. Why? I want to remind y'all about something. I want to remind you of her. This is Dr. Susan Moore. She's a Black doctor. She was a Black doctor. She died last month. She recorded this video. She was in the hospital fighting for her life. And she talked about the mistreatment, the lack of care and compassion. They wouldn't even give her pain medicine. And she died. They killed her. This was last month. And so as we think about trusting the system, as we think about trusting their system. Let's remember Dr. Susan Moore's words last month. Not back, oh, Tuskegee, that was a long time ago. We messed up a little bit, but we don't do that no more. We know we experimented on Henrietta and a whole bunch of black women to figure out how to be OBs, and we know we done did a whole bunch of stuff, but that was a long time ago, y'all. Get over that. Trust and believe us. Well, just last month, Dr. Susan Moore told us, and I quote, this is how Black people get killed. That's what Dr. Susan Moore told us as they were killing her in a hospital system where she was familiar. Black people experience neglect, mistreatment, harm, and trauma then and now. And it's not just in our healthcare system. It's not just at the hospital. It's with their insurers. You're trying to argue for coverage and care, and it might just be for something simple like birth control or your baby's asthma medication. Mistreated, abused, traumatized, given misinformation, not told all your options. Oh, don't be fat and Black. Everything is because you fat and nothing else. You can have a broken bone and it's because you're fat and we don't even see it. We're not even gonna look at your leg because you just fat, and that's a problem. It's not really broken. I don't see no bruising on the outside, so it must not be broke. Here, take these Motrin and go home. It happens every day. So when we talk about addressing systemic racism and ending, what's the code words that they're using right now, y'all? What do they say? Disparities in healthcare, because you got to look at the code words of the day. Looking at disparities in healthcare and all of that, you have to address the systemic racism at every single level. It's not just the experimentation that happened long ago. It's stuff that's happening every single day. It's us hearing and seeing brothers and sisters like Dr. Moore crying for help, saying, somebody please watch this video. Let my family know, help me. They killing me. Here's the doctor's names. Here's the nurses' names that's doing this. And then did y'all see the response that these people put up? I could show it to you. You could go on their website there. It's at iuhealth.org. It's a press release dated December 24th, 2020, directly addressing the issue of racial equity in our facilities. And it was put out by Dennis M. Murphy, their president and chief executive officer, who's committed to equity. I'm like, go read the bullshit for yourselves. I'll post the link in the comments here if you're interested in the response. It's not worth my screen time. But I just want y'all to know it's important that we watch how they talk about us. Because sadly, a lot of us believe the things that they say about us, even though what they're saying about us is not equal to our experience or what we know about ourselves. And we allow them to get away with this stuff. Racism in America. Yeah, we're going to get to a dear love letter and some other stuff. I know it's a lot of heaviness, but it's stuff we need to know about because it don't stop there. COVID, y'all need to know about because it's killing us every day and it's changing and evolving. I don't know why I'm talking to y'all. There must be some dust over here near my desk because I come over here and then I start allergy and whatever. Anyway, trusting the system. We talked about Dr. Susan Moore. Now I want to talk about Flint, Michigan. Those of you who have watched the Just Chamia show for some time, you know that for a couple years, every guest I interview, pretty much I asked them about the Flint, Michigan water crisis. And for me, it wasn't just because Black people in Flint, Michigan didn't have access to clean water, which is a problem. And I mean, they didn't have clean water to drink, to bathe in, nothing. And you think about how essential water is for life. Think about how essential water is during this pandemic. It's not just because they didn't have access to water. It's because it was a systemic extermination of a Black population with generational effects, right? If you look at the issues that children have and they could have for more and more generations, it could happen anywhere. It's happening in multiple places, actually. Look at these little predominantly Black towns that are next to all these industrial facilities through the South and different places. It's happening in multiple places in this country. So we need to be aware of that. But Flint, Michigan, for those of y'all who don't know, they had a water crisis that started sometime around 2014. I have a timeline here I can share from the Associated Press, an early timeline of the Flint, Michigan water crisis. And where are you going with this, Chamia? I don't have to recap it fully because if you don't know about it, Google it. Um, the gist is, and I'll read this. This is from an AP News article, and it's a timeline of the Flint crisis, the water crisis in Flint, Michigan. But you can Google Flint, Michigan water, and you'll get a bunch of different resources about what happened. But in April 2014, in an effort to save money, Flint began drawing water. There was an order. It didn't just happen. But anyway, Flint began drawing water from the Flint River for its 100,000 residents, predominantly Black residents, instead of relying on water from Detroit. The move is considered temporary while the city waits to connect a new regional water system. Residents immediately complained about the smell, taste, and appearance of the water and raised health concerns, reporting rashes, hair loss, and other problems. And it went on for some time. I will share on my screen very quickly from this nonprofit agency, just for a few of you. This is background, and then I'm going to get to what this means. The whole situation is racially motivated. Don't believe anything that says that it's not. But let me just share this with you for some additional background and context, and I'm going to bring it to today because it's not just about what happened then; it's also about what's happening now. So this is from NRDC, this nonprofit organization. They are let me tell you real quick because I wrote it down, National Resources Defense Council. Because what happened in Flint, Michigan, in my opinion, where did I lose it? Okay, here we go, is absolutely an act of environmental terrorism against Black people. So they have this guide, Flint Water Crisis, everything you need to know. So I just told you what happened in 2014. Inadequate treatment and testing of the water resulted in a series of major water quality and health issues for Flint residents, issues that were chronically ignored, overlooked, and discounted by government officials, even as complaints mounted that the foul-smelling, discolored, and off-tasting water pipes into Flint, Michigan homes for 18 months was causing skin rashes, hair loss, and itchy skin. The Michigan Civil Rights Commission, a state-established body, concluded that the poor governmental response to the Flint crisis was a result of systemic racism. Later studies will reveal that the contaminated water was also contributing to a doubling and in some cases tripling in the incidence of elevated lead levels in the city's children, imperiling the health of its youngest generation. There's more. Flint's water supply was plagued by more than lead. The city's switch from Detroit water to the Flint River coincided with an outbreak of Legionnaire's disease, a serious form of pneumonia that killed 12 and sickened at least 87 people between June 2014 and October 2015, the third largest outbreak of Legionnaire's disease recorded in U.S. history, as well as the discovery in 2014 of fecal coliform bacteria in the city's water, was likely a result of the city's failure to maintain sufficient chlorine, yada, 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 yada. Okay, these efforts paid off in November 2016. A federal judge sided with Flint residents and ordered the implementation of a door-to-door delivery of bottled water to every home without a properly installed and maintained water faucet. So the water was problematic. The pipes were all lead going into people's houses. For a couple years, they didn't have any access to clean water. Then 2 years later, a federal judge said, deliver water. But Governor Schneider seemed to signal that all clear in April 2018 when he announced that the city would stop providing bottled water to residents. However, it is important to note that thousands of Flint residents are still getting their water from lead pipes. So on. Why does this matter today? Well, here we go. This is an article from NPR. I'll post this in the chat in just a moment for Facebook, but I want y'all to see this. This is from NPR. The title, and this just happened just over a week or so ago, 2 weeks ago, ex-Michigan Governor Rick Schneider and 8 others criminally charged in Flint water crisis. Hold on, don't get excited. The Michigan Attorney General Office on Thursday announced criminal charges for 8 former state officials including the state's former governor, Rick Schneider, along with one current official for their alleged roles in the Flint water crisis. Together, the group faces 42 counts related to the drinking water catastrophe roughly 7 years ago. The crimes range from perjury to misconduct in office to involuntary manslaughter. The drinking water debacle is linked to at least 12 deaths and at least 80 people sick with Legionnaire's disease after untreated water from the Flint River caused yada, yada, yada. Schneider, here it is. A Republican who left office 2 years ago is facing 2 counts of willful neglect, both misdemeanors, which each carry a maximum sentence of 1 year in prison and a fine up to $1,000. Why is this significant, Chamia? Why are you sharing that? Well, I'm sharing it with you because all of it's an example of the systemic racism that's a problem in this country. It's not just when white supremacist terrorists storm the Capitol and aren't called terrorists, but it's also when people can poison thousands, 100,000 nearly Black folk and get charged with a misdemeanor and $1,000 fine. Okay. There's a ProPublica article, and this is crazy. I'll give you the high points of this without getting too much in it, but y'all just need to know this stuff. You need to know it and see it so you can see that systemic racism, it affects us on every different level. I talked about this. I don't know if y'all saw the little special I did the day before the inauguration, just had to get some stuff off my chest because I know a lot of us thought that we would wake up like Pete Buttigieg, we talked about earlier, and say, oh my God, it's beautiful where I am. Is it beautiful where you are? Nah, it's everywhere at every level of society. That's what makes it systemic. And then I keep talking to y'all about breadcrumbs. We get happy when, oh, they said Black people. Oh, they talking about us, good enough. No. Oh, they charging them elected officials. Oh, no. That's not enough. Oh, they arrested a couple of them people from DC. That's not enough. Breadcrumbs, y'all. Don't get distracted. You need a whole meal. You need nourishment. You need farmland so you can sustain yourself and your generations for generations. That's what you need. You don't need these little breadcrumbs. That ain't doing nothing for you. That's malnutrition. Okay. ProPublica. I put the link in Facebook. ProPublica on the 22nd, 2 days ago, published a piece, The Unfinished Business of Flint Water Crisis, where they started out about telling the story of this woman, the sister Yvonne Lewis, having to warm up water in a crock pot and then pour it in the bath and keep doing that until she had enough water to take a bath, and how sad that was for the reporter. Then they go on and say that on Thursday, so last week, a federal judge granted preliminary approval of a $641 million class action settlement in the Flint water case. $641 million, oh, that's more than $500 million. We should be excited about that. Pause. Dig into it. They believe it's the largest in state history. It will provide for, quote, every person exposed while a minor child, every adult exposed with a resulting injury, every residential property owner, renter, or person responsible for paying Flint water bills, and certain business owners, according to the decision. But there's more. Chamia, why is that a bad thing? Hold on, scroll down. The pending $641 million class action settlement may be the largest in the state's history. Show me, Chamia, so I can see it. All right. The pending $641 million class action settlement may be the largest in the state's history, surpassing the $500 million allotted 2 years ago to gymnasts abused by Dr. Larry Nassar. But given the huge size of the class, to say nothing about the attorney fees, because you know they're gonna get theirs off top. Given the huge size of the class, it may not result in much for any individual. For all that the city has lost, 95,538 people still call Flint home as of 2019. In comparison, the Nasser settlement involved 332 survivors. So 332 people split 500 million in whatever their attorney fees. Well, here we talk about almost 100,000 people, plus the attorney fees splitting 641 million. Very little is going to go to those people. What about the long-term health effects? Long-term care, free medical, world class. Are they getting that? What about their generations? We need to know these things. And my last thing, just on the systemic racism for this week, I guess it might be the last. I keep saying one more thing. Let me just put this in, because we got to keep track of this, y'all, because the rope a dope and the bait and switch is so just amazing to me. Thank you for the beautiful, informative, and caring show. Much love. Thank you for watching. Thank you for sticking in. I know it's long. If y'all can't watch the whole thing in one wide, pause it, see where y'all at, come back and watch it later. I know it's a lot, but it's everything that we need to hear. I just posted in another piece for y'all to be aware of. I'm going to share my screen for y'all, because this is some entertainment right here. Did y'all see this? The 23rd, yesterday. Today is the 24th. What they say, this from the Washington Post, but pick an outlet. It's picked up everywhere, actually globally. The United States Justice Department and the FBI debate not charging some of the Capitol rioters. I ain't even got to go that deep in it. Y'all come back and read this, because we knew that this was going to happen. First of all, problem. Capitol rioters. We talked about it last time on the 10th. I talked about it on the special that I did the night before the inauguration. So on the 19th, go back and watch that on my YouTube, y'all. You could see that. According to their definitions, their laws, because we looked it up and I provided links, I saw an act of domestic terrorism, but we don't keep calling them rioters, y'all. And now they discussing not charging it. Why? Federal law enforcement officials are privately debating whether they should decline to charge some of the individuals who stormed the U.S. Capitol this month. A politically loaded proposition, but one alert to the practical concern that hundreds of such cases could swamp the local courthouse. They talk, it's going to be too much for the courts, y'all. We just can't charge these terrorists because it's too much for our court system. The internal discussions are in their early stages, and no decisions have been reached about whether to forego charging some of those who illegally entered the Capitol. So here they go. This is what happens. They're softening what happened. It was not an act of terrorism. It was a riot. It was just some people who illegally entered the Capitol. The debate comes at a time when officials are keenly sensitive that the credibility of the Justice Department and the FBI are at stake in such decisions, given the apparent security and intelligence failures that preceded the riot, these people said. Yeah, because y'all helped plan it and gave access. Well, we know y'all warned folk too. But we know it's okay. But we worried about reputation and what people would think. Who would think? They ain't worried about what we think. I just want y'all to know, Black folk, they ain't talk about what we think and our perceptions. The primary objective for authorities is to determine which individuals, if any, planned, orchestrated, or directed the violence. Nevertheless, these people said some in federal law enforcement are concerned that charging people solely with unlawful entry when they are not known to have committed any other bad acts could lead to losses if they go to trial. But we know we want to win if we go. We just, quote, if an old man says all he did was walk in and no one tried to stop him, and he walked out and no one tried to stop him, and that's all we know about what he did, that's a case we may not win, one official said. Another official noted most of those arrested so far have no criminal records. Meanwhile, defense lawyers for some of those charged are contemplating something akin to a, quote, Trump defense, which is that the president or other authority figures, because there was a whole bunch of authority figures involved, gave them permission, including Congress folk, or invited them to commit an otherwise illegal act. quote, if you think of yourself as a soldier doing the bidding of a commander in chief, you don't try to hide your actions. You assume you will be held up as a hero by the nation, criminal defense lawyers, these two people wrote last week. Such a defense might not forestall charges, but could be effective at trial or sentencing. Hold on, y'all. They're not calling them terrorists, even though we see the definitions by the US government, what our Constitution, all these what the laws say about insurrection, about treason, about domestic terrorism. Go back and watch the show that I posted from the 19th. I provided links for you to go read it yourself. Not only are we not calling these people terrorists and insurrect, we're still saying they're rioters, and we're providing them free legal advice and defense here. I was acting under the authority of my commander in chief. I have no prior criminal record. Do y'all see the game? Y'all see the game. There's enough of us who have experience out here with the legal system to know it when we see it. Black folk, wise up. What does this mean? It means more of the same for us. And that's what we need to know. More of the same of Breonna Taylor getting killed in her house, of Trayvon Martin getting killed in the park, of Oscar Grant getting killed sitting on the BART platform, of George Floyd being choked out, of Jacob Blake being shot in the back at close range with his kids in the back. It means more of that. It means more of being discriminated against at work. It means more of everything that more Flint, Michigan. That's what this shit means, y'all. It means more of the same. We can't rely on them or their new administrations, as they may change, to tell us and show us justice, fairness, and kindness. They're not set up for that. That's why there's a system in place that makes it so. And here their system is telling you and showing you what they planning to do. Yes, it was reported in this case by the Washington Post, but pick up another publication, it's the same thing. Officials from the FBI and the Justice Department saying, we likely not even gonna charge these people. It's gonna overwhelm the courts, and most of them ain't got no criminal records, and they could just come in and say that they was following orders, or they came in, they walked out, and they didn't even do nothing. So maybe they was trespassing. Let's just not even do it. And it wasn't even terrorism. It was just they came in when they shouldn't have came in. Pay attention, y'all. That's what's happening. Meanwhile, how many Black folks that's sitting up in prison? How many folks that's experiencing all kind of racism and hate? Or how many Dr. Susan Moores out there? This is what we need to know. All right, I am way over scheduled on stuff. And it's a hard left turn. I know I've covered a lot. Oh my God, but guess what? Life be a lot sometimes, y'all. A lot happened this week, and it's stuff that I want y'all that we need to know. We have to stay gamed up. We have to stay gamed up. I need all of you to be aware so you can move in a way that's most healthy for you. You can make the best decisions for your life, all of that. And then even better, share information with others who may not know or who need to know, even if they hear some more. We need to know this so we can protect ourselves and live and be healthy. All right. Hey, y'all. You not late, you on time, but I covered a whole lot, and I really do hope that you go back and you watch, for those of you who are joining. And for those of you who tapped out early, I hope you come back and you finish it, because wow, what a whole bunch of information, right? Stuff we need to know. All right, I'm pivoting. Woosah, that was a lot. Let me sip from my beautiful cup from my mother-in-law. Thank you. Orange is my favorite color, and I want to talk about self-care. What you all have been doing for self-care to take care of yourself in the midst of the crazy and all that life is. For me, what have I been doing these past 2 weeks? I have been going and walking a lot more, looking at trees, and all the birds are just so happy. Just flocks of birds like I've never seen before, just so many. But it's been lovely. Gardening, so really doing more prep for my spring planting and imagining new and different things, and spreading Black love. I know sometimes with all this, the hardness that is life, and I come in with rainbows and sunshine and love and light, you be like, what is wrong with you, girl? Why are you so chipper? And that's just who I am. And guess what? That's what we need. I need that. I need that positivity, and I love being able to give and to love on people, and I don't want to stop, and it feels great. It's so therapeutic, and I encourage you to do it. It feels good just giving love. So that is, those are some of the things that I've been doing for self-care. But I would love to hear, like, what are the things that you're doing for self-care? What are some of the things you recommend for self-care? Put them in the comments. Text me if you have my number. DM me. Email me info@Chamia, because we need to be doing that. Go to the Nap Ministry on Instagram and listen to that word and get your rest in. All these things. Self-care is essential, y'all. And I have been doing that. And yeah, and daydreaming and on possibilities of, if I could wave a wand to rule the world. Like, sometimes fantasy is also healing and therapeutic. So as long as you know the difference between fantasy and reality. So those are some of the things that I've been doing the past week or so for self-care. I want to hear from you, and we are going to pivot really quickly and get into, because I am over time, I am going to do just one love question topic today for Dear Love the Movement, hashtag Dear Love the Movement. Again, please keep your love letters, love questions, love topics coming in. We want to hear about you, and hashtag Let's Talk About Love. As a reminder, I am not about putting people on blast. So if you write something to me, I am not going to share your name. I am not going to share the name of anyone that you may include in your love letter, question, or topic. I can change them up or omit them altogether, because it's about, positivity and really spreading love and light. And we need that in our Black community. We need Black couples. We need Black marriages. We need Black families. And so that's what I'm here for. It's not about woman bashing, male bashing, couple bashing, institution of marriage bashing, none of that. We need all of that, and we're capable of it. I believe in it. So keep your love letters, questions, topics coming in. Let's do that. Okay, so Dear Love the Movement, let me get to it. All right, question. Chamia, can you be in love with more than one person? That's a question. Okay. What y'all think? Can you be in love with more than one person? I see y'all commenting about your self-care. I appreciate that. Lots of Marvin Gaye. Locking your door if you have kids and family members. You don't want to be bothered. I know that's right. All of that. Can you be in love with more than one person? So before I give you my answer, let me start with what does it mean to be in love? A lot of people think that you fall in love out of love with the person. So if you in love with a person, can you be in love with another person? And okay. In my opinion, I don't fall in love with someone. I grow in love with someone. I don't not love anyone that I've ever grown in love with. It's a fact. If I grew to love you 20 years ago, I still love you today. And those people actually know it. I do. It's just the way that my love works. And that's really what unconditional love is. I think a lot of us are twisted on what love is. And even what relationships are, what dating is, all God, just all messed up. And then when you get into a coupling or your interaction or engagement with a person, you're not starting with having some foundational discussions around how do you define dating? How do you define relationship? How do you define marriage? How do you define love? What does that look like? And I think before you're getting into these situations with people, you need to have a mutual understanding around what these things mean and what they look like to you. Now, for me, love is divine. Love is God, and I'm love. So I am a spiritual being derived from divine love. And for me to give some of that divine essence to someone else, well, one, it's not for me to take back. God made it so for me to love you, and so that I do. And it's coming from a pure and loving place. So that is what it is. And I've grown to love you. Now, I cannot love you maybe in or like you in the same way, or I could choose not to deal with you, but I love you. So by that logic, then getting back to the question, can you be in love with more than one person? My answer is absolutely yes. Absolutely yes. I could love him and her and him, but I'm with who I'm with. Or I ain't with none of y'all. And it doesn't mean that I don't love you. It doesn't mean that I don't love you. We just not together. And togetherness is a whole nother topic. But can you love more than one person, be in love with more than one person? Yes, because I believe you grow in love. You don't fall in it. You grow that way. You grow in love with the person. And if you're giving love, then you should never try to rescind it, because then that's not love. So I see some yeses. I'm assuming that those are yes, you can be in love with more than one person. But feel free to disagree. If you want to talk about it more, message me, DM me, email me, info@ChamiaLaRae, DM me @justChamia anywhere, or here on @ChamiaLaRae on Facebook. YouTubers, y'all can DM me anywhere on social media @JustChamia. Email, drop a comment in the YouTube. Of course, remember to click that subscribe or the notification little bell so you'll know when new episodes are posted. But yes, in the meantime, because I'm over time, we'll do more Dear Love letters at the next show. Please keep them coming. Email me, DM me your Dear Love topics. Let's keep #Dear Love movement going, because that's what it's all about. Before we close out, because again, I'm out of time, I want to give a couple shout outs for good-ish. I want to shout out the children, the kids. I'm talking about grade school, so high school and down, that are at home during COVID, or, they living through some craziness. Even where they going to school, like physically to a location, they're at home. They are going through some craziness with the pandemic, with people looking different. Like, have we paused to think about how weird it is for kids to see people with masks on and acting weird and being socially distanced, and them not being able to run and do the things that are natural for children to do, dealing with their parents being more stressed out, and family and people being more, all of that. But in the midst of all that, still having that child joy and curiosity and resilience and bounce back. And, so shout out for the kids. I love you. Love you, children. I also want to give a shout out to the truth tellers, because again, as we talk about the war on Blackness, there's absolutely a war on truth as well. So shout out for those who are truth tellers. I appreciate you, and we need y'all. We need more of you. So keep telling truth and speaking it loudly, because we need to incline our ears and our eyes and our hearts and minds to truth. So shout out for y'all. I want to give a shout out to Marilyn Jones, now Dr. Marilyn Jones. She reached out to me this past week, and it was actually surreal at the time when I got the call, and it came in through my business line. And, I was like, there's Black people on the phone. Hey, who's this? And I hadn't talked to this woman in some years. Dr. Marilyn Jones was a guest on the Just Chamia show some years ago. She's the author of a book, From Crack to College and Vice Versa. And she has an amazing life story, amazing charge on her life, and things that she's doing for empowerment, for Black people, Black women. And she reached out and she said that she had to find me because someone else had gone on YouTube, that Googled her, and then the interview that I did with her came up, and they watched the show, and it was a great interview. And so they reached out to her, and they're like, wow, I learned so much. It was a great interview. And she shared with me that she had never watched it. She had never watched the show. She had never watched the interview that I did with her. So she did after this person reached out to her. And she loved it. And it made her feel so good. And that the content was still true and relevant today. And that meant so much to me. And it meant so much to me for her to acknowledge the work that I'm continuing to do on screen and really out here in these streets, and that she's heard about it, and then just supporting me and edifying the work that I'm doing. That was beautiful. Also, she shared that she is now Dr. Jones. And I'm so proud of you, Marilyn, for getting your your doctorate degree. Not only that, but she's also continuing to do great work in our community. So she has started, um, it's called Because Black is Still Beautiful. It's a nonprofit organization, Because Black is Still Beautiful. Their website is bbisb .org. I'm going to paste it here in the chat for y'all here on Facebook. I am just so proud of her. Not just for, continuing to fight for her education and continuing to improve herself, which is amazing, especially if you consider all the adversity that the sister has had in her life. But not only is she continuing to do that for herself, but she's continuing to serve our Black community. She's continuing to strengthen, empower, and uplift Black women and Black community. And then she's reaching out to people like me and saying, sister, I appreciate you and the work that you're doing, and keep fighting, because it's not easy. It's not easy. As I've seen other Black truth tellers having their internet throttled, or some wonky stuff happening on social media. I mean, it's all kind of different ways that stuff creeps in, or me getting hate messages from white supremacists or white supremacist sympathizers threatening me and calling me all kind of. It's not easy, and it's not just even that. Doing it all on your own, whatever it is. It's just, I'm not going to go into all the ways, but the point is, I appreciate her reaching out. That was so, it was sincere, it was thoughtful, it was on time, completely unexpected, and the work is so necessary. And so, thank you for reaching out to me. Thank you for supporting the Just Chamia Show, Marilyn, and thank you for continuing to push forward for yourself and for the betterment of our Black community. I'm so proud of you. If y'all have shout outs for Good Ish, feel free to put them in the chat, but also, post it, tag somebody that's doing great stuff. We need that in the midst of all the craziness that's going on, living in this country that is built and to, keep us down, to keep us down, to keep us from growing and being our best, to kill us in a lot of aspects. We need the good news. We need the Black love and light. We need to hear all the positive examples, and we need to give shout outs for people who are doing great things, including our children, as I said today, the truth tellers and Marion Jones. So thank y'all for continuing to support the show. Again, I've shared lots of links and information between today, last week on the 19th and the 10th. Go back and watch. I will be back. We will be, continue checking in. I'm here for y'all to talk about the issues that we believe matter most to us. So, let me know. Keep the emails coming, the texts, the DMs, all of that. I appreciate your support. Black people, I love you. Chamia loves you. Until next time, be blessed and be a blessing. Holla.